What if I told you that your vision problems like dry eyes, macular degeneration, glaucoma, and others did not in fact start in the eye, but instead started in your gut? Sounds a bit crazy, right? Well, new research is showing of something called the gut-eye axis, meaning that bacteria and microorganisms in your gut could be silently destroying your vision. Today on the Dr. Eye Health podcast, I interview Mila Loussifova, who's not only an optometrist and dry eye specialist, but also holds a degree in nutrition. And she helps break down how the gut microbiome is connected to eye diseases and what type of foods you can eat to help. Today's episode is made possible through InMode and the Envision workstation. If you've never heard of Envision before, this technology offers groundbreaking, non-surgical, and highly efficacious dermatological procedures, including bipolar radiofrequency and intense pulsed light. Two procedures that myself and many other dry eye specialists frequently recommend to help improve our patients' quality of life. In fact, the Envision workstation is the exact same model and technology that we offer to our patients here at our clinic. To learn more, you can check out envisiontreatment.com. We'll put links in the show notes for you. And stay tuned because we'll be sharing more details about this fascinating and impactful treatment later in the episode. And hey, if you find value in this information coming directly from real doctors and researchers, then be sure to hit the subscribe and follow buttons, because that will not only help us reach more people like yourself, but also if you turn on that notification setting, you'll be reminded anytime we post something. And so that's not just something that helps us, but also helps you. Otherwise, thanks for being here, and let's get into it. So, Dr. Loussifova, I'm making sure I say that right. Thank you so much for being here. This is always an honor, and just to be able to spend some time talking about not only eye care, but talking about the topic of nutrition, diet, and now kind of gut health and the gut microbiome. This is a topic that I think is getting a lot more light and interest, especially in the last 7 or 8 years as more information about the gut microbiome has been surfacing in kind of just the medical world. So you yourself are not only a doctor of optometry, but you are a dry eye specialist, and you've been running a dry eye specialty clinic for close to 10, 15 years now, right?
Yes.
And then you also not only have all of that accomplishment, but then you also have more of a formal degree in nutrition, and you're a board member of the Ocular Wellness Nutrition Society, or OWNS. So I'm really honored and really happy to have you on here to kind of talk to us about diet and nutrition from your perspective. So with all of that, can we just kind of kick it off? Tell us a little bit kind of how you even got into nutrition, and that being such a kind of a focus and interest of yours.
Yes. Well, first of all, thank you for having me. The honor is all mine. I know how much you talk about gut health and nutrition when you are talking about dry eye and other conditions. So this is a topic that's very exciting. And as you know, I lecture on this, and I talk about the correlation between gut eye axis. And the reason why I got started and got interested in it is I've been practicing for 18, 19 years, something like that. And my primary focus really from day one of practicing, within a few years, I started to really pay attention to dry eye conditions and patients that are struggling with dry eye. And when I opened my practice 13 years ago, it was a cold start practice. From day one, I started to invest in all these advanced treatments. So in-office procedures, there's thermal treatments, there's IPL treatments, light procedures, all the advanced. At this point now, fast forward, we do a lot of in-office procedures. We even do blood draws and make autologous serum, autologous PRP in our office. So we're treating dry eye at a high level. But there was still something missing. These patients that I was doing everything that I had in my power, they were still not getting better. So I just kept looking for answers. What's missing? And obviously I knew that nutrition, and that plays a role in a lot of diseases, a lot of conditions. And dry eye it's an immune mediated disease. We've known that. We know that dysregulated inflammation is involved in dry eye. So I started to dig a little deeper. what I found was my own knowledge of just nutrition and nutrition science was limited because, as you know, in optometry school, in medical schools, we don't learn too much about nutrition. So then I started to do, take classes and really look into, self-education. I've been a part of Ocular Wellness and Nutrition Society from my residency, and that was a while ago. And I learned that with being part of a society, I was exposed to a lot more education, and then that led me through them to actually get my certification, which is through American Nutrition Association. So it's a accredited certification. It took me a long time to get. Took me almost 4 years with 1,000 clinical hours working with a nutritional supervisor, which was great because I was using these cases to present my cases, my own patients that had dry eye disease, that had autoimmune conditions, that had other, metabolic dysfunctions. So I was able to help them get past the in-office treatments or the pharmaceuticals, and I really on personalized nutrition level really able to get them feeling better with their eyes and also other symptoms as well. So this is how I the drive or the need for incorporated nutrition was from my dry eye patients, and that's how I started to really get into it. And the more I was learning, the more I was like, oh, there's so much I still don't know.
I know it's typically a lot of times, like, again, I think most people who go in to see an eye doctor, or even sometimes their medical doctor for anything, uh, people don't necessarily, I think, even expect to hear guidance on diet and nutrition. And so, do you ever have patients who come in and see you maybe for a consult about their dry eye, or even just like routine care? Do they ever get kind of confused, or do they respond in a weird way when you bring up nutrition or ask them about their diet?
Yeah, I think it's always, the patients will give me a funny look if I ask them about, or when I ask them about their bowel movements. They're like, why are you asking about if I have regular bowel movements? But that's how I assess. Those are, I do have questions on your, your sleep, your exercise level, your stress levels, and, and what you're eating. And if you have regular bowel movements, that gives me just a quick already a synapse of or the picture of what is happening with your, GI system. If you have a nice, healthy microbiome, if you have a healthy GI function. So I get funny looks for sure, but I also get patients that are really relieved, or they feel so excited that, oh, I know. I mean, people know about the importance of the gut health and nutrition, lifestyle, all of those things in everything. But when their eye doctor makes a connection and brings it up and says that, hey, let's work on other things as well while we're working on your meibomian gland function, your ocular surface homeostasis, all those things that we're going to be working on, but we're going to go broader. We're going to go, bigger. We're going to do more like comprehensive approach. And so patients kind of get that sense of relief that I'm hearing something new. I'm not hearing the same thing I've heard from the last 5 doctors I've seen who just told me use more lubricating drops, use ointments, do warm compresses, it's just like same thing over and over. Now they're getting more options. And what I love about when we talk about nutrition and lifestyle is that you're giving patients the power to do something themselves, right? To make those changes. And and without a doubt, when they make these, even small modifications, they feel better, not just on the ocular surface that we were trying to address, but really systemically. They feel better energy. They tell me their skin is clear. They tell their hair is feeling better, it's not falling out anymore. They sleep better, so that's what's rewarding. And that's really why I love incorporating this functional medicine into my treatments, into my patient education, because then I'm impacting or empowering patients to do a lot for themselves, but also I'm really positively helping patients in all aspects of their life.
Right. And I can just kind of echo that same thing. Even from a personal experience in my life. And I went through my training, and I've shared my story in some previous episodes of, with residency and everything. You're trained really hard to just, diagnose, prescribe medication, instruction on follow up when what your plan is. And it's kind of rinse and repeat. And it's very focused on just the medical side of
Right.
training. Uh, but then I started listening in and recognizing, hey, when I educate my patients for like diabetes, for example, I would say, hey, just eat a heart healthy diet, make sure you follow up with your family doctor, take your medications, and we'll see you in, 6 months, 12 months. And then I finally was like, wait, when I'm telling people to eat a heart healthy diet, what does that even mean? Like, I never got training on what that meant. And so I had to start digging into it. And as I started reading things and I started changing some little things in my diet, and I started experiencing these changes in my own life. And so I just wanted to echo that and share kind of a little bit of my story. I think you're right. People are starting to become more interested and aware of how these diet and lifestyle factors affect so much of our health. And there's quite a bit of discussion on the gut microbiome and how our gut affects many different parts of our body, including the brain. And as you kind of mentioned earlier, what is called the gut eye axis, right? I've heard gut retinal axis and then just gut eye axis. Uh, do you mind kind of just starting off that conversation? Can you kind of set the playing field of what the gut microbiome is and really why this is such an exciting discussion in the field of not just medicine, but in eye care specifically?
Right. So microbiome, we have microbiomes in different parts of our bodies, right? We have it on our skin, we have it in our mouth, we have in on our ocular surface, intraocular microbiome as well. The biggest ecosystem of this microbiome of the microbes is in our gut. And if you hear the word microbiota are the microbes, and microbiome is the ecosystem that makes up that microbiota. And microbiota is like trillions of microbes, and this is these are bacteria, viruses, protozoa, fungi. So they're different bugs. I mean, we're full of bugs on our skin, in our body, and different tracks have essentially different microbiota, and so different levels of mouth, and then going down the intestinal tube, and the highest concentration is in the large intestine, colon mostly. So these microbes, they have this symbiotic relationship with the host. So they are there to really benefit our body. They are communicating with, they have essentially, especially the beneficial, the commensal bacteria have this beneficial effects on the body. So we have, if you kind of categorize it into the pathogenic bacteria, the microbes that are harmful for the body, they release more of the pro-inflammatory metabolites. And then we have the beneficial, the good guys. These are the commensal bacteria. These are the bugs that really help to kind of regulate our immune system, to make sure that our immune system is not going haywire. And then, that's when like autoimmunity and things like that happens. And there we have a nice balance. We don't have all good bugs and all, we don't want to have all bad bugs. We have more of the good commensal bacteria that kind of, regulate the microbiome, and less of the pathogenic, so that the pathogenic don't have the opportunity to overpopulate. If there is an opportunity to overpopulate, they take that opportunity. That's what they call opportunistic bacteria, pathogens, and then they start to overpopulate. And this is what's called dysbiosis. So when there's that imbalance, where there's more of the pathogenic microbes in the gut, this is the term that's used, dysbiosis. This is when we start seeing things go dysregulation happens. The immune system becomes dysregulated. More of the pro-inflammatory mediators are, upregulated in the body, and then that can trigger autoimmunity. And as you know, with autoimmunity, which is such a complex, group of conditions that really they go in pairs. So if one autoimmunity is triggered, then a patient is more likely to have another one that can come up in 10 years, or so that dysregulated immunity really drives that that disease process. So for patients, for example, if they and as with autoimmune conditions, dry eye is you can't avoid it. You're gonna have dry eye. So if I suspect patient has autoimmunity, I'm even more aggressive at looking at the gut health, and more aggressive with really helping, especially if they're younger patients, because that's usually when we start seeing some signs of that dysregulation. And then that for the next 20-30 years they may have more problems with their immune system. So that was a long answer to kind of tell to your question of what is gut microbiome, but it's such an important role. I mean, it's literally the control center of our immune system. That's kind of how I think about it. It's not just the immune cells, but our hormones and our essentially like our nervous system. So it really has it's without the proper gut health, the whole body, the whole system, I think, can be very disrupted and dysregulated.
Right. And I've read even that, and you kind of mentioned there that there's some influence over like our nervous system, right? There's certain metabolites that somehow make, I believe, make serotonin, right? Like a large percentage of that is made
Yes,
first
yeah.
in our gut.
Like up to 90% of our serotonin is actually made in our gut, and 70 or over 70% of our cells are in our gut too. So it just makes sense that what's happening in the gut really is important. What happens in the gut doesn't stay in the gut. It really does affect all systems. And we have a lot of evidence on the gut brain axis, right? We keep talking about these different axes, but gut skin axis, but gut brain one is really huge. There's strong evidence on how gut health really affects conditions like depression, anxiety. So patients with dysbiosis are more likely to have those conditions, and those conditions could be more severe the more severe dysbiosis we have.
I know I want to get into specific kind of like what causes gut dysbiosis or what's good for the gut, what's bad for the gut. I definitely want to get into that. But first, I think there is this bit of a mystery because we're talking about the eyes, right?
Mhm.
And certainly we have this connection between the brain, and we know like we have cranial nerves that go all the way down to our gut. But it's like, how would inflammation or changes to the gut somehow get to the eye, right? There's a couple of different theories I've read in a couple of publications, but can you speak to that? Can you kind of break down how the eye can somehow respond to these changes?
Yeah. So I mentioned how we have really strong evidence on the gut brain axis. As far as the gut eye axis, the evidence is growing. So even as we speak, more articles are coming out, more evidence. So a lot of in animal studies, but we are seeing in human studies as well. And then the theory that's been accepted is that what's happening in the gut lining, and this is again not just when we're talking about the eyes, but in general. Um, well, I'll get to the eyes as well. But what's happening in the gut ecosystem, in the gut microbiome, is that when you have a nice, healthy microbiome is there's no dysbiosis, so we have more of the good bugs doing all their anti-inflammatory. They're releasing short chain fatty acids, and they're keeping the gut nice and healthy, which means there's the nice strong lining of the gut. There's a mucosal lining that's protecting the gut integrity essentially. And that means that as eating food, ingesting food, and that we're digesting it and absorbing all the nutrients, and then we have enough fiber to kind of move what's not needed out and excrete it. And when we now have a dysbiosis, and we'll talk about what causes dysbiosis. So now we're in a scenario where there's a imbalance of those microbes. So these pathogenic bacteria, now they're releasing more of the bad things, and one of them, these metabolize these things that basically microbes release. One of them is lipopolysaccharides. So they release these pathogenic bacteria. What they do in that environment is that they're eating up the lining of the gut. So they're actually digesting the mucosal lining, and then they actually cause separation of the enterocytes. Those are the cells of the lining of the gut. So now you probably heard the term leaky gut. So we have this
Mhm.
permeability of the gut lining, and things that are not supposed to get into our bloodstream, like toxins from bacteria, like LPS, lipopolysaccharides, and other like protein fragments and things that are, again, should be excreted because they're not digestible, they're not helpful for the body. They now get absorbed into the bloodstream. Now, these are foreign bodies in the bloodstream, and the body recognizes that as, hey, this shouldn't be here. And they release these pro-inflammatory mediators, interleukins, and cytokines into the bloodstream. Now we have this heightened immune system and this increase of the inflammatory mediators in the bloodstream. And then what's one of the most vascularized organs in our body? I mean, the eyeball is there's a lot of blood vessels, right? So now all these inflammatory mediators, get to different parts of the body, not necessarily just the eyes, but eyes are also one of the end organs. So that's how kind of we see this. So what's the inflammatory processes and inflammatory mediators that really started in the gut because of that lining, the breakdown of the lining, and now it's in the bloodstream, circulating through to the brain, to the joints, and to the eyes. And what's interesting is, and I talk about this in one of my lectures when I talk about gut health, is that we've isolated. There was a study that looked at the microbiome of, so these were patients that were getting cataract surgeries, and they took, this was a metagenomic sequence of the aqueous humor. So they took samples of aqueous humor on patients that were getting cataract surgery, and there was a group of patients that had no other eye conditions. So they just had cataract surgery, but no glaucoma or macular degeneration. And then there was a group of those patients that were getting cataract surgery who had macular degeneration, and there was a group that had glaucoma. And they did all these metagenomic sequences on all of those groups, and they identified specific pathogens that were specific for that disease. So it's really fascinating to kind of see that, some microbes maybe biomarkers for a disease that we can identify maybe years before the patient, develops that disease.
Wow, I'm glad you mentioned this. I don't think I've read this study, so I'll probably have to see if I can get the citation for that one, and I'll try to include it in the show notes too. But that's fascinating. I think the only studies I've really found were again more in like dry eye specifically, and then they've been able to find, hey, for patients who do have more autoimmune conditions, like Sjogren's, for example, they have a distinctly different gut microbiome than people who are either normal without dry eye, but even compared to the people who do have dry eye, but not necessarily autoimmune Sjogren's defined, those dry eye people kind of their gut microbiome is not normal, but it's also like somewhere in between. It's like, is it heading toward that autoimmune
Mhm.
level of gut dysbiosis? I've read a few publications on that.
Yes.
Do you recall? I'm sure you read. I think
Yes,
you might
I've
have
heard
mentioned some of
those.
those in your
Yeah.
lecture.
And there's some, studies now, again, not a ton, right? We don't have like a really strong, hopefully that'll change in the next 5 years, 10 years. But one of the studies showed that changing modulating the gut microbiome actually did change the inflammatory markers released by the lacrimal gland. So these patients that had dry eye, they were put on specific probiotics, and they actually was probiotic with prebiotic, and we'll talk about that combination. So these patients, after 4 months, they had improved signs and symptoms, but also the inflammatory markers were decreased in the ocular surface. So it's really fascinating. Again, it's not surprising because what we talked about, with the what happens in the gut microbiome, is really affects all areas of our body, but the inflammation essentially we know is a driver, is a corporate in a lot of the systemic and even ocular diseases. So modulating the gut microbiome to help with reducing inflammation should be, again, the goal that we ultimately do for all of our patients with dry eye. Because what we do with dry eye treatments is we really focusing on the eyeballs, right? We're just like, all right, let's put some drops in, some immunomodulators, let's do some treatments that reduce inflammation, but that's just localized inflammation. So we really have to look at it as supporting the eyeballs systemically.
Now, I want to take a moment to discuss a significant factor in dry eye, which is that of meibomian gland dysfunction, where inflammation in the eyelids contributes to swelling and the clogging of the oil glands in those lids. That contributes to decreased tear production and tear film instability, which is where the nVision workstation from InMode comes in. Again, this is the exact same device that we offer here at our clinic and is a technology that offers non-surgical and highly efficacious dermatological procedures that have been Health Canada certified for improving the symptoms of dry eye disease from meibomian gland dysfunction. The InMode Forma Eye radiofrequency treatment uses radiofrequency energy to generate heat. This improves blood flow and stimulates collagen formation. This gentle heat also helps open up clogged meibomian glands, helping with tear production and secretion. Whereas the InMode Lumecca IPL uses the energy of light to seal off irregular blood vessels that release inflammatory mediators to the eyelids. Research has also shown that IPL can help reduce Demodex and bacteria along those eyelids, as well as provide some level of photobiomodulation, which is the stimulation of the cellular mitochondria in the treated tissues. Again, these are two procedures that myself and many fellow eye doctors frequently do recommend for helping improve the quality of life for our patients who are struggling with meibomian gland dysfunction and dry eye, with so many of my patients absolutely loving the results, both in their dry eye symptoms, but also in just how their eyes look. To learn more or to see which doctors or clinics are offering this technology near you, go to nvisiontreatment.com or check out our link in the show notes. Now, of course, dry eye and eye health is complex, so always consult a licensed provider in your area to determine what is right for you. Otherwise, thank you again to InMode and the nVision workstation, and let's get back to the episode. So just to kind of rewind and sum up, so when we eat food and we're eating foodstuffs and probably on a long enough timeline, right? Because it's not like, oh, I just ate one bad thing and now the gut's thrown off. Maybe. I don't know if there's such a thing. But
if your gut is not resilient, then yes. But that's
there we go. But we eat foodstuffs and these foodstuffs maybe are not the best for our gut and we're having a harsh reaction. The gut lining can get kind of broken down, or metabolites from this dysbiosis, this buildup of not so friendly bacteria, these microbes release these metabolites or endotoxin that can get through the gut lining into the bloodstream, that pass throughout our body, and our body's own immune system kind of gets shot really high levels, right? It's starting to be hyperactive. These immune cells are going throughout the body, and that kind of kicks up inflammation into overdrive into all systems in many ways, right? That sounds like a good summary, like just on a basic level?
Yes.
So specifically with the eyes, now again, I know the research is still kind of coming out and research takes a lot of time and money, but when you see a patient, like what are some of the like conditions or eye issues that you've either read have a connection to the gut or you've personally seen in somebody's eye and been like, wow, there might be a connection here?
The strongest evidence we have is for uveitis. Uveitis, macular degeneration, glaucoma, and dry eye. Basically everything we see. All the ocular diseases we see essentially have now evidence to be linked somehow to gut dysbiosis. And if you think about it, it's probably not surprising. Some of your patients that you can recall with the most advanced glaucoma, if you look at their systemic health, they probably had a lot of systemic conditions also. And, we sort of like always, link them like, okay, patients with diabetes and cardiovascular disease, they're higher risk of having glaucoma and AMD. But we didn't make the connection of why. We just assume, okay, this patient has family history of these ocular diseases and they have systemic conditions. So they're higher risk of having these conditions. If there's a suspect, then you may be monitoring them a little closer. But those systemic conditions started with something, right? It started with poor diet, poor lifestyle, and all of that. Again, I'm just kind of summarizing. We're like making assumptions of like the gut, they had a dysregulator or they had gut dysbiosis. But that's what the evidence is now showing, is that really dysbiosis has been identified to be connected to most, if not every, non-communicable disease. So anything from Alzheimer's, obesity, diabetes, to skin conditions, eczema, rosacea. We see a lot of patients with rosacea. That's kind of become a big thing in eye care, right? Because of the connection between meibomian gland dysfunction and rosacea. Rosacea patients, they have imbalance of their skin microbes. They have an imbalance of the gut microbes. So very high likelihood that they have some GI problems, these patients. So this is where the connection happens, right? So recognizing that, all right, you have these things that are you're coming to me for, but you also have these other things that most likely related to this. So let's go a little bit broader and not just focus on meibomian glands and eyelid hygiene and things like that, but talk about rosacea and what's flaring up your rosacea. It's probably you have some gut imbalances, and it may be mild and it may be in control of it, but or they have like flare-ups here and there. But a lot of patients don't know that this is all connected.
Mhm. I was going to say that probably the biggest thing when I think of like glaucoma, uh, diabetic, any sort of diabetic retinopathy, macular degeneration, like the number one thing that kind of connects them all that I see is obesity. And that one kind of it's connected between all of those. But I did want to come back to the rosacea just for a moment because we've talked about rosacea a little bit here on various videos and even podcasts that we've produced, and we've talked a little bit more about the surface or the skin microbiome or the eyelid microbiome. But are you telling me that there's a stronger connection between rosacea and the gut as well? Like the gut being upset can cause these flare-ups in rosacea?
Yes, rosacea patients I've seen in my practice, and when I mentioned earlier how I had to do cases, first line
Mhm.
nutrition, a majority of my cases were dry eye patients with rosacea. And I found, and then I looked into literature, yes, sure enough, um, high proportion of these patients with rosacea have some gut problems, whether it's IBS, IBD, irritable bowel disease, or etc. Like H. pylori. Small intestinal bacterial overgrowth is a huge one. Up to like 60% of patients may have some SIBO, and a lot of times these patients don't. They say if you start asking them like, "Hey, do you have any GI things? Do you have any?" and they'll dismiss it. They're like, "Oh, I've always had, yeah, I have had IBS for a long time, or I have always had gut." So they may not be diagnosed, or they may be diagnosed as sort of like it's not bad enough that it's dismissed. But you'll see if you start asking these questions, your rosacea patients, and sometimes it's not. They don't think that it's a problem. Once you start asking, do you have regular bowel movements? Do you have any, food intolerances? Do you get bloated easily? Do you get uncomfortable after meals? Do you, if you start asking specific questions, they'll be like, oh yeah, I've always had that problem. So it's sort of like accepted as like just part of them. but they don't understand that, no, that's not normal. And it's probably getting worse because you're not doing the right things to kind of mitigate that and fix that. But also, it is connected to your eyes. And as you get older, it is not going to be connected to other things that will pop up later.
So let's kind of dive into like how do we in a way remedy this? But before we talk about like maybe foods that are ideal for the gut, but also maybe for the eyes, uh, what what do we know? Maybe an instigator. What kind of causes or contributes to gut dysbiosis in the first place?
When we there are many things, but if we talk about just the food, it's the standard American diet, the sad diet, which is highly processed, high saturated fats, high sugar, low fiber, low phytonutrients, low color, very, browns and white color. So that's one of the things that when I talk to patients about, if I give them personalized nutrition, talking about color in their food, a lot of variety. Our microbiome, the good bugs like fiber. They like a lot of, variety of fiber. That's how we help with the diversity of the microbes. And so when it comes to food, essentially, a lot of processed foods, things that come in packages, frozen foods and or frozen like pre-made foods. I'm not talking about frozen vegetables and things like that. I would say also like just eating out a lot, right? So we don't know what we're getting in our food. So people will be like, "Oh, I eat pretty healthy," but when you ask them, how much they cook at home and how they cook at home, and no, they're eating out a lot, and but they think that they're eating healthy. So it's essentially standard American diet, and also, if we're talking about outside of food, there's other things. People take a lot of supplements. Some supplements, may actually cause more harm. And if you're taking, obviously, like antibiotics, if you've taken that early on in life and or frequently, if you get sick, and that you may be getting sick because you have dysregulated this gut microbiome, and that actually makes you more susceptible to getting colds and flu and things like that. And other things, stress is a big one, which people don't think. People know that stress is not good for them, but stress can actually change your microbiome. Sleep can change your microbiome. Sleep is, yes, it's there's no light in our gut, but
You can
it's
probably see my facial expression. I was like, "Wait, what? Sleep affects my
uh,
gut?"
the light. Yes, so just being outside, being exposed to light can actually have an effect on the gut microbiome, and sleep can have effect. Being outside essentially helps to regulate our circadian rhythm and help with our sleep. But so many Americans, I mean, I'm guilty of it too. When traveling, poor sleep, and then but I feel it. I feel it the next day. It takes me a while to recover from poor sleep, but sleep is a big one too. So when I talk to patients about gut health, these are the things I talk about. It's not just the foods or the drinks that we. It's about whole approach, stress management, exercise. That's another thing that affects your microbiome. I think I read somewhere even like different types of exercise can make shifts in your microbiome too, like strength training
Mm.
versus a cardio or, things like that. So it's really interesting I think this whole science of microbiome is changing so much so rapidly. We understand some things, but there's a lot of things that we're still learning of really how to help and support our microbiome. But it really, yes, starts with food. That's the obvious, but there's other things that really are supportive as well.
I know I've spoken to a few other eye doctors who we've had like basically a history of GI issues since they were young, since they were a teenager or early college, and we were just kind of discussing, like, was there something that went on in our early lives, and the kind of the common denominator between all of us, and perhaps everybody in maybe our generation, is we had a lot of antibiotics as young kids.
Hmm.
Like I had a lot of earaches when I was a boy, and well, I was sick. So what did my parents do? Bring me to the pediatrician's office, and I get a high dose of antibiotics. And then, sometimes you get sick, and then you get sick because kids often do that, right? They pass
Yeah.
whatever one flu to the next kid, and then 3 weeks later they get the next round of flu from the other kids, and that's daycare, right?
Mm.
Uh, and so I just know that is kind of something I've talked with a few other professionals about. Like, I wonder if being exposed to different and many rounds of antibiotics as a young kid, did that upset my GI in a way? Started me kind of in back a few steps before
Yeah,
I could rebuild it to a normal level. It's tough to say, but
absolutely.
those are some thoughts.
I mean, it goes even like further up than that, right? We get our microbiome from our mother when we're born
Mhm.
through a vaginal canal. So that's our first exposure to. So really, our microbiome depends on how good our mom's microbiome is. And we get that. But, with so much sterility around hospital settings, and if it's a C section birth, then the baby is not exposed to that healthy microbiome. And then depending on who's holding the baby right away, if it's a nurse or doctor, they're getting exposed to their essentially, surface, whether it's their glove or, whatever they're set down and things like that. So it really starts from birth and how we're exposed. And in the first 3 to 5 years of our life is where it's really variable. So this is the time to really expose your kids to dirt, to animals, to just have them play in the garden. I mean, that's the best thing. They put them, take them to the garden, have them play in the garden, and not over sterilize things, not over clean things. To the more, you got to be responsible. You can't just be responsible with that. But as a mother, I remembered, just being obsessed with cleaning things all the time too, because that's just like what you think. You want to keep everything sterile around babies, but really babies, develop their immune system and their microbiome by being around good bugs. But then yes, and then so if the kid is not exposed, if they don't have a good diverse microbiome, they're more susceptible to getting sick. And now we add antibiotics to that problem. Now that's causing even further dysbiosis and really killing off your good bugs. Because when we take antibiotics, they're not super specific, right? Yeah, you might have like specific antibiotic you're taking for that condition, but they're also going to wipe out beneficial bacteria. So they're not just addressing the pathogenic bacteria. So when we're taking probiotics or excuse me, antibiotics, we should actually come back to that, the combination. I just thought of that, but we're really not being specific, and we're killing off a lot of our good microbiota as well. And this has really changed the way I address how when I prescribe like oral antibiotics. I used to years ago. In our state depending on the state as far as like ODs prescriptions in our state, we can do oral antibiotics. And anytime we had a patient with a sty that was not improving, especially if it was now looking like there is going to be preseptal cellulitis or, spread a little bit more, or if they have ocular rosacea, it was not well controlled. I would, so I was I didn't hesitate to prescribe doxycycline or other antibiotics as needed, oral antibiotics. And my approach has changed completely. And if I do have to use oral antibiotics, because I mean, we need to have, we need to be able to do that. I'm not saying
Yeah.
never prescribe it, but talk to all the options. And I talk to patients about options. We can use this antibiotic to treat this condition. We can do IPL treatment to treat this condition. These are your options. And then have the patient be involved in their decision. Here's the pros and cons of this approach. Here's the pros and cons of this approach, And, but if the patient is going to go on antibiotic, it is important to also put them on probiotics to really support their gut health and make sure that they can kind of repopulate the diversity of their gut microbiome over time. It could take time, and I've read that just a single course of antibiotic can take up to 2 years for you to recover some of the microbes in your gut. So it could take, and some of them will never recover. So we, so we just have to be like more mindful of that when we are prescribing antibiotics, and really tell patients about all the options and potential harm in this approach, and how to support their gut health if they choose to go that route.
Yeah, and that's kind of my approach when I talk with patients as well. I like to give them all of their options. Of course, there's cases where it's like, no, we need to kind of be the general in charge and be like, no, this is you're in a potentially dangerous situation. We need this medication. But I try to be open to being like, hey, same thing, pros and cons. Here's where we're at, you know. But as far as probiotics, you kind of mentioned that's a big discussion, because now you go to the supermarket and you'll see probiotics listed almost as if it's, 2 times protein. You'll see that on cereal. But now it'll say with probiotics, right? It used to just be yogurt had probiotics. Now it's like half of everything at the store has them. Can you speak to like what are probiotics versus the label of prebiotics? And probably just to make it simpler, let's talk about just probiotics first. Like, what are probiotics when you see it as an additive versus is it a supplement like a pill form? Should everybody be taking these? Should we be cautious about them? Can you just give us some insights on it?
Yeah, this is a big topic. And this is where I struggle a little bit, because people want a simple answer, and it's not a simple, here, take this probiotic and all your gut problems are going to go away, or your eye problems going to go away. So it's not simple. So I'll start with that. But essentially what probiotics are, they are the microbes that are put in a supplement form. These are not always the commensal, but beneficial. So they're the positive affecting microbes that are put in a supplement form, and sometimes they'll be sold in powder forms and other added to things, right, to foods and things like that. The problem is that there's so many companies now making probiotics, and I don't know if you've heard of like consumer review. So I have a subscription, so it basically like looks at things and really tells you, how valid, or how, if the label really matches what's inside. And one of the things that's really alarming about probiotics is that a high majority of them don't actually have active cultures. They don't have the active, microbes in the capsule. So they're really, maybe they started out as those live bacteria, but now that they've been sitting in the capsule, on a shelf, by the time you take them, you may be just taking empty capsules. So there's really nothing that's going to be benefiting you. So another thing is that a lot of probiotics they'll say that they're extra strength, or, they're women probiotics, or this and that. But if you look at the back, and I tell patients to always, and I'm sure you do this with your patients too, if they're taking fish oil, you say, which one are you taking? Because you want to make sure that it's a quality fish oil, meaning that it is in, a specific form. Like I recommend triglyceride form, that it has a high, adequate dose, and it's the right form of EPA to DHA, all these things that I sort of look at before I say, okay, this is a good one, continue to take this, or no, this is not really doing much, let's switch you to something else. I do the same thing with probiotics. But for probiotic to be evidence-based, has to have a strain. And what that means is that in probiotics, like if you take a, probiotic bottle and you see the back of it, if you don't see actual microbes that are listed, like lactobacillus, and then it'll have for example, the one that I have here. I'm not promoting this one, but this is the one that I'm taking currently. It's Probiotic Max, and like this one has lactobacillus, acidophilus LA14. So lactobacillus is the genus, and then we have acidophilus, which is the species, and LA14 is the strain of the probiotic, what makes it efficacious. That means that that specific strain, that bug, has been studied to benefit something, and now is put in the probiotic form for you to take, because it's going to be positively affecting your body in one way or another, whether it's helping your immune system, whether it's helping with your, helping with the production of the good bacteria, helping to suppress the bad bacteria, whatever it's been studied, but that's how now it's, has the evidence. So if you go to the, grocery store and really look at all the probiotics, most of them don't have that. They have like probiotic blend. It'll say probiotic blend. And what does that mean? We don't know what's in it. So choosing probiotics is very important. They are good probiotics, but you just have to know what to look for. The other thing is that when you're, just like with anything, if you're actually eating it in the food form, you're getting a lot more diversity. You're getting all the other benefits from the food. So obviously we have some sources of probiotics like fermented foods, tempeh, tofu, kimchi, sauerkraut, all those things, kombucha to some extent, but a lot of them are high sugar, so you can incorporate yogurt, kefir, like all these things. So you can incorporate a lot of it just from foods, but taking probiotics may be beneficial. But what's more important is the prebiotics. Prebiotics is what your microbes actually eat. So these are soluble fibers that we get from our food. And that is, so you can take probiotics all you want. You can spend a lot of money on the good probiotic, but they're not going to stay alive in your gut if you're not actually feeding them. They are bugs. You got to feed them. And you got to feed them the prebiotics, which is in our food. So these are, things like artichokes, onions, garlic, chicory root, bananas, specifically like green bananas, oats and barley and things like that. So these are the things that flaxseed, that you can actually, it's important to, if you're going to take probiotics, you got to make sure that you have a good, diverse diet of prebiotics so that what you're taking is actually going to stick around. They're not going to, die within a couple of days of essentially not taking them.
Yeah. I'm glad you kind of segued into that, because that was kind of my next question. Okay, well, what are the foods that are good for the gut, but maybe can double up and be also good for the eyes? You already mentioned that some fermented foods may have living cultures of good probiotics in them. And then fibrous food. There's lots of different, there's so many different fibrous foods. But can you give us some examples of maybe some of your favorite, like fibrous foods that may be beneficial for the gut, and maybe anything that also could be good for the eyes?
If we think about what is the evidence on what's good for our gut and what is good for our eyes, the type of diet and lifestyle is the Mediterranean diet. Mediterranean diet has lots of whole foods. It is mostly vegetables, fruits, whole grains, and that's like, and legumes and beans and things like that. So my favorite, to answer your question, I was telling my husband the other day, if I could just eat one type of food for the rest of my life, it'd be different beans. Not only one type of bean, but different types of beans. I love bean soups. I love to incorporate beans in different things. I love to throw them in the salad. So I would say that is probably the healthiest, that with some omega-3s. So healthy fish, your sardines, your mackerels, your salmon, right? So incorporating different type of seafood that are high in omega-3 polyunsaturated fats and also olive oil, so into your diet, essentially Mediterranean diet. And that has very little processed foods. It's not completely eliminated. That's the thing we said earlier, is that, you eat it once and are you thrown off? No, if you have a healthy diet overall, healthy microbiome, is resilient to having, a piece of cake, not a whole cake, but a piece of cake, and not feeling like, oh, now you're going to have a flare up. You're going to have, that means resilience, right? A gut resilience to, things that you want to eat occasionally, cupcake or whatever, so just not eating it every single day. So Mediterranean diet, and what I like to also always emphasize is that it's not just the foods that you're ingesting. So it's not just lots of phytonutrients, vegetables, and fiber, and all those things, which makes up majority with legumes and whole grains. And then you have seafood, every day or every other day. And then you have poultry that's less frequent. So eggs and cheese and dairy and poultry and things like that are maybe a couple of times a week. And then red meats and more, maybe definitely not processed red meats, but more good sources of red meat, and maybe a couple of times a month. And then what's really important with the whole system is how you actually eat your food. So it's really not takeout, not getting those foods and buying them at a restaurant and eating them at home or on the way home. It's actually cooking together with your family. It's smelling the food. It's it's enjoying the process of making the food. It's sitting down with your family and enjoying that food, talking about the food. It's there's so much happens to our nervous system when we are actually taking the time to eat our food and chew it and really feel the texture and the taste of it, and have that connection with your family while you're doing that. It's not what I see a lot is people eating in the like drive-throughs and eating in their cars. It's just like the worst thing. You don't digest that food properly. And you don't, it's your when you're driving, you're like your nervous system is on your fight or flight, your sympathetic nervous system. We can't digest that. So it's this and this whole sort of like holistic approach to nutrition. It's just incorporating a lot of things, not just what you're eating, is how you're preparing it, and also physical activity and stress management and things like that. So when I talk about what's healthy to my, when I discuss this with patients, these are the things, I'll give them resources on. Sometimes I'll give him, a lot of times I'll give him actually recipes and things like that because people don't know. So I'll help them with getting started. But I always talk about, other things that are important too. So move your body every day. Make sure you have a bedtime. Set a bedtime. Stick to it. Go to bed. Make sure you're rested, and do something to help with your stress. So many of our patients with dry eye, they have a very dysregulated nervous system. They're more on fight or flight, and they have more of the sympathetic overstimulation, overdrive of their sympathetic nervous system. And it's the parasympathetic nervous system that helps with our digestion, but also our secretion from our glands, from our lacrimal glands. So I tell patients that it's not just the food, it's really working on your nervous system as well as your gut health.
Well, I know you covered a whole bunch of really good points there. I think that basically you've opened up a couple of different questions. I know we just don't have time for today, like the sympathetic nervous system, and we could probably dive into that in another topic. I do want to give a call out to all of our viewers and listeners that if you have questions, if you're like really interested in this and you want to be able to ask us questions about what's going on with the gut or dive a little bit more deep into a certain subject, let us know in the comments. Let us know in the review over on the podcast platforms, because we'll hopefully be able to bring Dr. Loussifova back on for another episode. We'll be able to dive into those questions to kind of bring things back to where we began talking about dry eye, and you manage and specialize in treating patients with significant dry eye disease, right? Probably everything from very mild beginning symptoms to people who have been dealing with for 15 plus years. What kind of things do you see in terms of what's going on with dry eye treatment that you think we're missing as a profession? Because I love asking other eye doctors, especially people in the realm of dry eye, like, we see a lot of the same things repeated again and again and again, but is there anything that you think we're missing?
I think we've come such a long way from where we used to be 15 years ago when we're treating dry eye. So it's great. It's a great place to be. We have a lot more tools to offer to our patients. We have a lot more knowledge, and there's just more innovations coming out, more treatment options coming out for our patients. So it's great to have all that, but we have to still remember that this is a immune mediated disease. We have to think about it as not just a dysregulated localized immunity on the ocular surface, because we do know that there's loss of homeostasis, there's increased oxidative stress on the ocular surface, there's increased inflammation. But what we're missing is that most likely there's a systemic correlation in these patients. And I think a lot of now the focus is getting so much on, devices, we're buying all these equipment to treat ocular rosacea and treat the inflammation on the localized. Patients may feel good for a short period, but then the problem comes back, right? So we really have to start thinking broader and start thinking, do we support what the dysregulation that's happening on a bigger scale, their immune system and their nervous system and their mitochondria, So really all these things that have to be, in my opinion, which is why I went back to school to study and to really, because I felt like, no, some patients, no matter what you do, just don't get better. And when that happens, this is when it's good for our colleagues to stop and think, okay, instead of doing the same thing over and over, can I do something more? And if I'm not the right doctor, maybe I'll send it to the right doctor. Maybe I'll co-manage it with a functional medicine doctor. Maybe I'll reach out to a nutritionist and say that, hey, let's get you connected with this patient so you can talk to them about, other things. So it's really making the connection, I think, is where we need to think as dry eye specialists, as we're treating patients with dry eye, is that if you start asking the right questions about just gut health, make that connection that, all right, their problem in the eye is not just in the eye, it's starting in the gut.
So just our final thing, just to make actionable steps, because I love it when I listen to other podcasts and they give me like some actionable steps that I could take to better my life or kind of open a level of curiosity. Do you think you could give like, what would be your top 3 things for someone to, whether it be in their diet or in their lifestyle, to focus on that may make some positive benefits for their gut microbiome? Can you give us maybe your top 3?
When it comes to diet, is number 1, removing as much of the processed foods as possible. It may not be right away. Maybe you're, taking out one thing a week and then slowly working up to having mostly whole foods, incorporating more fiber. Again, maybe you've never liked beans, maybe starting with one type of bean and see how you can like to cook it and incorporate it. And then making sure that you're getting a good amount of omega-3s, whether it's, if you don't like fish, make sure that you take quality supplements. So those are the 3 things when it comes to diet. And then other 2 things I think is really important to talk about: sleep. Most people don't sleep well. They don't even know. They're just like, oh, they have variables. So that's what I mentioned, is having a bedtime. You remember when we were kids, we had bedtime? We need to set bedtime for ourselves and tell patients that you have to have a bedtime. This is when your nervous system has to reset. And that when that resets, that helps your immune system, that helps everything. So sleep is the other thing too. Sleep hygiene, making sure that, turning off electronics 2 hours before bed and things like that. And then lastly is movement. Movement is important. It's important for our mitochondrial health, and it's helpful for our metabolism, our nervous system, and everything. So again, you don't have to do crazy exercises, just walking, right? So walking after meals, or making sure that you have enough movement throughout the day. So those are the 3 things I would say. I know that I talk to patients all the time, and I think they're not crazy ideas. People have heard that. So it's not like anything new that they're going to hear, but coming from your eye doctor who's treating your dry eye is going to now maybe click even more. Like, oh, I've heard this from my primary care doctor, but haven't really stuck with her. I've heard about importance of doing these things. But now when your eye doctor also says, who's treating your dry eye, says that, no, these things are important. They're going to help with your immune system. They're going to help with your metabolic system. And it's going to help with your nervous system. That's, I think, is actionable, and for patients, something to take with them. And you could give resources. You can write it in your treatment plan. So along with all the other treatments you're doing, list these things, whole foods, movement, sleep.
Well, with all of that, thank you so much for just sharing your time with us, dropping all this knowledge onto us. As far as a way for people to get a hold of you, if they happen to be in your area, can you mind just sharing your clinic name and location?
Yes. So I'm in Portland, Oregon. South Waterfront Eye Care is the name of the clinic. I can also be found on social media. Dr. Mila is my handle. And I'm always happy to connect with colleagues, with patients. I love helping people with their dry eye and obviously incorporating everything that we talked about today.
Well, again, thank you so much for being here. And hopefully I look forward to maybe having a part 2 in the future.
Thank you. Thanks for having me.
You've been listening to the Dr. Eye Health Podcast with Dr. Joseph Allen. For more resources, trusted information, and helpful tools, visit dreyehealth.com. Thanks for joining the community that's focused on healthier eyes and a healthier life. Until next time, stay informed and keep your vision sharp.